and exchange of ideas. So it gives me a great honor to introduce our moderator for this session. So I introduce Associate Professor Dr. Hafiz Mat Zain, who was our former president of Malaysian Association of Medical Physics, or MAM Society, and was formerly the first council member of the Malaysian Allied Health Professional Council under Ministry of Health Malaysia. So with his extensive experience in a medical physics scenario in Malaysia, this would make him an ideal candidate to guide us through this discussion ahead. And it is hoped that he will bring a wealth of knowledge and a passion for facilitating a meaningful dialogue to our forum today. So without further ado, I invite Dr. Hafiz to take the stage and lead us through this enriching forum session. Thank you.
All right. Thank you very much, Dr. Ika, for your very kind introduction. Assalamualaikum and good afternoon all. I hope everyone is still okay, still awake after the long day. Good. So, also selamat petang. So we'll be conducting this session in both English and Malay. So feel free to also participate in our discussion. So later we'll share the link to participate as well. So first of all, I would like to welcome you all to today's panel discussion on the progress and future of the medical physics in Malaysia. Thank you for joining us here in UPM and also online through Facebook Live. So today we are very fortunate to have distinguished panels to share insights from various perspectives, including academia, professional organizations, public sectors, and industry. Thank you to Dr. Diana, Chair of the Scientific Committee, for coming up with an excellent array of panelists here that we have. First, I will introduce you to all the distinguished panelists that we have here. Because of the interest of time, we only have 1 hour. So we hope that we don't drag the time, because I know you have to hurry back. For those here, have to hurry back before the traffic started. So I'll just briefly introduce you from my left, Dr. Nora from University Putra Malaysia, Dr. Jenny from University Malaya, Dr. Husaini from Malaysian Nuclear Agency, Miss Kala from Beacon Hospital, Dr. Rosanna from Quantum Excellence, Puan Mahzon from Institute Cancer Negara, and Dr. Heng from Sunway Hospital. You can find their bio on our program book, so you can read more about them. But I will also project their biography later during the Q&A sessions. And we also incorporate Slido to engage with the audience. So you can start scanning this QR code so that when times come, we can show you the questions that you can respond to. There's a background sound. Okay. So is the QR working? I can ask the people here.
I think it's not.
Just a
The other delay between here and the Facebook. Understand?
So first we want to know the audience here and also online. So actually this is an indirect questions to gauge your age actually. So how old are you? So we want to know when you started working in the profession, so we know what's the demographic before we can address a specific issue later. So to start the forum, so allow me to introduce, give you some background. So especially for the students that are probably new to the field, so this is what is medical physics about. They are like what you've heard during the sessions this morning. There are mainly 2 components in the training and education of medical physics. The first part is the physics and medical physics education. And after that is the specialist clinical training in the field. Often they specialize in one of the 3 areas, which is radiotherapy, nuclear medicine, and diagnostic radiology. And if you look at, we had this forum before, and we have gathered a lot of informations in terms of the challenges and opportunities and strength that we have. Like you've heard from Ms. Kala about X774 as a strength that we have. We have also established education institutions that have offered masters in medical physics since the 90s, one of the first in the region, right? But we have this, we can also share as opportunities or challenges in terms of the workforce structures that we have, the education and training background, and also to support the physics professions. We also have qualified multidisciplinary team members. We have clinical specialists that are well regulated, and we also have a lot of hospital with state-of-the-art facilities. So these are the things that if we put together well, we can sort of help in advance of, sorry, I think the slides is changing automatically. It's not time, actually. So we can help with advances in physics, technology, and development in the field, mainly towards improvement in our patient care. Right. So without further ado, I'm going to go to the first question. So before we go to that, so it's interesting to see they are mostly started in 2014. Right. So I think not far from my age, actually, 2014. Because I started in the profession 2012, but I did all my degree until PhD. So yeah, maybe a bit later. So maybe you are mostly younger than me, about 3 to 4 years old. So we're gonna start with the next Slido. Let me change the Slido question as well. We also want to know about what you think of the most important role that you think professional organization can play in advancing your career. But before we look at the results of that, let me go. Can we switch back to the PowerPoint, please? All right. So I'm going to go to our first panelist, Dr. Nora Maliza, President of MUM. Dr. Nora, so could you kindly elaborate a bit on how professional organization, especially MUM, that you are leading now, is actively supporting the growth and development of the medical physics community here?
Okay, thank you very much. Good Assalamualaikum and good afternoon, everybody. So regarding about the questions from Dr. Hafiz, how actually MUM support the growth of medical physics professions. Actually, for your information, in Malaysia, we do have 3 organizations who represent our professions. I'm not sure you are aware or not, which is we do have the Medical Physics Division under the Institute of Physics Malaysia. We also have the MUM itself, and also we do have a Perfect, Pegawai Sains Physics KKM. Okay, but compared with the other countries, we have 3 currently. However, I do believe the objective of establishing this professional organization actually to help the professional development. As I listed here, actually there are 4 main rules of professional organization. The first one is professional development. Second one about awareness. Third one is excellence, and final one is partnership. So when we talk about the professional development, actually the organizations, either IFM, MUM, or the Perfect, actually we are aiming to developing or offering the continuing the education's opportunity to support the professional growth. How to do that? Actually, that's why we do have the a series of conference and also the workshop in order to make sure that our medical physicists are equipped well with the cutting edge technology. A part of that, for the awareness, how actually the professional organizations can enhance the reconnections and visibility of the professions. Of course, if you can remember, every year we will celebrating the 2 main special event to highlight the rules of medical physics in worldwide. Yeah, the first one maybe I can give the example for that we I think last week we celebrating the International Medical Physics Weeks, and then in April usually we will celebrate IMPW, and then in November we will celebrate the International Day of Medical Physics, right? So actually, why we are doing or celebrating this week or that day, because we want to show to the others profession that we are exist. Because if you look at why our profession is not so popular compared with the other health professions, because we are working in silo, we are working, actually we are like what we call unsung hero. We did the job to make sure that our machines is working well, but nobody recognize us. Either we exist or not, nobody know. Yeah. So that's why the IOMP have an initiative to celebrate the IMPW and also IDMP. So how actually we also can show the existing of us. Of course, we have to engage with policymaker SOP that we can establish in our own center, because we are working not alone. We are working with the multidiscipline, like in radiology, we are working with the radiologists, we are working with the radiographer and the others profession like nurses, right? So that's why to make sure that we are visible in our clinical setting, we have to get along with the team. Okay, and then apart of that, of course, excellence. So how actually we are going to show that we are competent enough, okay, carrying out our job. Of course, that's why we are planning, okay, to have different kind levels of the medical diseases, which is we are going to introduce CQMP, which is clinical training program, later on with the collaboration with the IFM and also with the prefects later on. Because we know that in the other countries, they are recruited the CQMP. Okay, but ours, we just now, what we had now actually just only the general medical physicists. Yeah, and then of course, to make sure that we are qualified enough. Of course, we need to have the structure standard program, which is, I think, Dr. Jenny will cover later. And then, of course, professional organization should support our medical physicists to do a research by providing the research grant, and also our professional organization should also have a power to give us certifications later on. Yeah, because now nobody recognize our expert. Yeah, our if we are have a 10 years experience, we're doing a great clinical jobs, but nobody said that we are expert in our field. Nobody recognize it. So that's why by having the clinical training program, so we can introduce a different kinds of levels of the medical physics. We can have a medical physics, we can have a CQMP, and then after that we can also have the medical physics consultants. So finally, about the partnership. Of course, the professional organizations should be able to help, okay, promoting the collaborations and cooperations among medical physics society globally and regional. Because now we can see when we would like to have a benchmark where we are now. So of course we need to collaborate with the others, society regionally or globally. So by actively participate in the international level, of course we can boost up our profession not only in Malaysia but the other international levels. Okay, that's all. Thank you, Dr. Hafiz.
Thank you, Dr. Nora. So recognition has to come from within our fraternity, our brothers and sisters in the hospital, and as well as externally. I think that's a very important point there. So perhaps we can go back to Slido to see what the audience think, how professional organization can support. Yeah. So the main response is networking. I think that was highlighted. Also in terms of knowledge, not sure about support. I think support covers all the other areas surrounding it. So I think this requires, I think, we coming together, like Dr. Nara said, so that we actually make use, optimize our resources that we have towards the same objective that we want. So before we go to the next panel, I'm going to go next to Dr. Miss Kala, sorry, Miss Kala First, I would like to congratulate your appointment as a council member. And then I think we already heard from you about the progress of AHP. And maybe in today's we can summarize a bit and also conclude on how that would impact the professionals in the field.
Okay, good afternoon, everyone. So I think earlier during my 2 p.m. Talk, I've also updated about what is AHP and how does it actually link to our profession as medical physicists. And those who are going to practice in this line, actually, we are also under this act. So currently, if you can see, just in terms of the registration status, I think this is basically awareness, lah. I suppose many of us are not aware. So I hope after this session, actually, you all will be able to go back and ask your respective colleagues or other partners to actually come up front to register. If you can see from the government, it's about 60 over percent, and private sector, which just has started, is about 15%. And the timeline that was actually set by end of this year has actually been extended, but only till June 2025. So I think it's very, very important because working in this field, I think for the last 20 over years, at least now I feel there's a framework. There is something. So I think it's not easy for even those working groups who actually have come all the way to come up with this framework. So I think we should come all out and actually support. And part of it is we have to be registered because as Dr. Nora said, unsung heroes, nobody look at us, but this is the platform that you can make people to look at you. At the same time, bring up your standards. As you've been hearing in this session, there's a lot of the CQMP and all those things. And you see in the Act also, there is a provision for you to be registered as an expert. So how do we actually define how you become an expert? So of course, it will boil down from, do you have a CQMP? Do you have this kind of structure? So, so in terms of allied health profession, although they are governing 16 different profession, but we ourselves, medical physicists as a scope there, and the main advice to the council will come from the professional society and all. So I think moving forward, as you mentioned, combining to have one objective, basically it should be one objective, then it'll be easier to actually bring this to a higher platform and make us actually hear the outside world need to know. Actually, I think those of you all who are working in the field of nuclear med, radiotherapy, radiology, they do a lot of work together with the doctors. But sometimes they feel, nurses got nurses week, as you mentioned. But I don't think anyone in the hospital actually celebrate the physicist work week. In fact, physicists themselves, some of them may not know this is the physicist week or physicist day. I'm very sure about that. Correct? So I think we as well have to celebrate ourselves first. And in this accord, apart from AHP, I also take note that there are a number of practicing physicists, probably not even in any of these societies. I think probably in the government or public sector is like you mandatory, you have to be. But if you take from the private sectors, I don't think they are like mandatory have to be in any organization. But I think it's important that we all should be part of one of the organization. In fact, if you all are able to consolidate, that'll be easier for everyone to be under one person, so we can actually move forward. That's anything else. If any, I'm okay to take any questions.
Okay, thank you, Ms. Kala,
Welcome.
for that response. Okay, so we're happy that we are hearing the same thing to be unified and to actually to work towards this common goal and to make it happen. So so like Ms. Kala said, to develop this unsung hero. So we have accredited program. Even Dr. Jin is actually was the head of the medical physics program. I think now you're still the head of program. Okay, so maybe you can share briefly about the medical physics program, and also now today we've heard a lot about AI and how you're actually changing the curriculums to include all this aspect. So yeah, I can go to those.
Yeah. So thanks, Dr. Hafiz. So we can just go to the next slide. So, well, I guess I wanted to just, since we talk about AI and we had a lot of talk about AI just now, did you all understand everything that the speaker said just now? Do you understand? I didn't. I mean, there's some part of it I understood, that not every part of it. So this is a survey that we did in 2020. We had more than 1,000 respondents from 94 countries. And basically, we surveyed how medical physicists thinks how AI is changing our work profession. And really, 85% thinks that, yes, it's very important. It's changing our practice. But however, only 40% says that they learn it on their own. And 40 of them say that they don't have AI skills. And I think that kind of resonates with everyone, many of the physicists here as well. Because medical physicists, in terms of curriculum, our intake, most of the time we take physics background student, at least in the UM program. I believe in the USM program mostly at that as well. We don't take programmers in our program. So which is right, which is true, because medical physics, you still need that understanding of physics, the foundation to help you progress, understood, solve matters in medical physics. Yeah. So but since AI is really coming, and we really have to adapt, equip ourselves to face it. A lot of people are actually doing on their own, but that's only a minute percentage of the people who can do this. Not everyone can do it on their own. And oftentimes, we can have, you can press the next button. So I'm just saying that a lot of people are learning AI on ad hoc basis. They attend courses, 2-day courses, or few hours of courses to try to learn what is AI. But that is not adequate to be able to be competent or be well-versed. So in terms of curriculum, in Malaysia, we already have 2 programs, that is the Master Medical Physics program, and I think the programs are quite similar, the content as well. And we also have a bachelor degree of medical physics from USM as well. These are the curriculum and the programs that train the, have the medical physics curriculum. But however, I believe the curriculum is not yet, they don't have sufficient AI content in there to equip the students or the graduates with the understanding of the AI that's coming now, because AI is still new, right? So I believe curriculum, medical physics future curriculum should have a bigger component of computer, of AI and programming involved in there. But we must understand the limitation of education program. We can say we want a lot of practical, we want a lot of programming, we want a lot of everything. That will take 7 years probably to finish, just like how we train our doctors. So if you only want to finish your course in 4 years, that's not going to happen. So there is something that we have to give and take. But I think it is very important for medical physicists to have the understanding, at least what AI can do, how it is doing it, and also so that you can troubleshoot it, so that you can understand the limitation of what it can do. It's not magic. It cannot do everything, like the speaker has just said just now, that if we just take any AI tools in our QC program and just use it, control all the OARs in 1 second, but you never check it, it's very dangerous. It's very dangerous. And so understanding, I'm not saying that everyone needs to be a programmer, but I think if we understand the logic of how it works, and still, most importantly, we need to base it on physics. You understand, as a medical physicist, you understand how the workflow is. You understand what it involves when your medical physics work in it. You understand what need to be QC, which part of it is important. This part, you have to take care of it. Because at the end of the day, you're the one still responsible for the program, the medical physics work, the QCs, the machine QCs and all that. not the AI tools that is used to help you. So yeah, so that's already all right. So basically, I think the conventional syllabus does not have this sufficient AI curriculum. And one of the things also sadly, we also do not have sufficient staffing, the people that can do this well, not many people. So we might need to have a change in that. But if you want to know about what are the curriculum that are available, even TCS 56, that's the IEA program, academic program for masters, doesn't say place a lot of emphasis on AI. It does say you need computing, but it doesn't say a lot about AI. But the European, the IFOMP has already published a paper that recommend a syllabus for medical physics to enhance the education of AI in medical physics. So it is something that is quite extensive. It's not something that you can input in 1 year program. It will be something that you think about in 2 or 3 years master's program. So yeah, it's a long journey. And I think in Malaysia, we have even a unique situation where we have our allied health recognizing practicing medical physics at the undergraduate level. I think it's an opportunity as well, because you can't fit a lot of courses in 1 year master's course, but you can possibly try to fit something bigger in a bachelor degree. So hopefully we can achieve some kind of a balance in here as we move forward in medical physics education. Thank you.
Thanks, Dr. Ginny, for your insight. So I forgot to mention, we do have a Slido on AI to test whether you really understand AI. So perhaps we can switch to Slido. And in the meantime, maybe I'm going to ask one of the first graduate of the medical physics program on how you see. So you were a student back then, and then you have actually worked in the hospital for quite some time. How do you see the importance of the education when it comes to later when they're working in the field as a medical physicist?
Okay. I think being a student almost like, I think the first batch maybe 23 years ago when I did my master's, 23 years ago. Yeah. So yeah, after master's. So to be honest, I think when you come out, because you just do 1 year and you come out, I mean, you finish, because I'm from UM, so 4 years of degree in physics and then 1 year of master's of medical physics. So when you come out, yes, you do have a master's. And I started working in the radiotherapy field. But before I got a job, I actually did on my own accord. I actually wrote to radiotherapy department. I just did an intern on myself for 6 months. That means it's just I wrote and got the permission. But even then, I think when you first start to work and you work with consultant, it all sounds like French, like you don't know anything. Okay, so I think the main gap, even though that course is done and we introduce, okay, this is the LINAC, we were attached to that. But I think the duration and the expectation of what a physicist need to do in the private sector when you come out, your expectation is different. So what we are actually producing versus what is the expectation out there does not meet, does not gel. So majority of the time, and I would say in my own experience, for me to say that after this many years, I consider at least I know, I feel I'm skilled to a certain level lah. Maybe it took me 5 years. They say I took it 5 years. And when I started back then, there was no IMRT or VMAT or anything. It was all computer planning with conformal, so you start from basic, and then now, of course, everything is computerized. But having your basic knowledge helps you a lot. Okay, so I know nowadays everything is very easy, very simple. It's just a touch of your finger. But I think your basic concept and understanding, because medical physics is a very applied field. And when you're actually doing clinical work, right, you got to understand what you do. Yes, you are working with together with the consultants and all that. But finally, whether you know a plan is going right or going wrong, you should be able to explain and apprehend that yourself. Okay, so I think the gap that I would see, if really we are going to do this as a undergrad degree level, I think, in fact, even some global papers or even they always feel that this program, since it's so applied, it should come with a residency sort of attachment, which I think all of us who worked in it cannot deny that lah. Because we know how it feels to go out there and really practically feel like, I don't know what, you have to really, if you're lucky enough, you meet the right people, you do a lot of right work. So it's solely based on your dependent, where you work, what sort of load you see, what sort of patients you get. So that builds up your experience. If you ended up in a place where they are also silo, then it's quite difficult for you to grow. That is the actual truth in it. And I think, of course, you see, integrating an AI to a certain level, because medical physics is a very evolving field. And technology advancement, you cannot stop. So be it the syllabus or whatever, we'd have to evolve. But how much of AI, whether you want to be really a programmer, that is upon an individual, but I think the application of how AI is going to work or affect their daily life, a physicist must understand. They must be able to apprehend that knowledge. A lot of time I feel what they don't understand, they just stick by the books, but they are unable to apprehend. So that is one of the some of the gaps that I feel. And I think critical thinking, physicists must have critical thinking, problem solving skills. This is what is going to help you on your day to day. That is my opinion and my experience so far. And I think moving forward, when we are consolidating all this, I think this is the structure or way we can look. Because once you have this, you're going to also make sure that our physicists tomorrow can be able to go for a CQMP. Why? Because that you will be in par with globally other physicists as well. So that should be the way moving forward that we should look at. Okay. Thank you.
Iskandar.
Thank you.
Right, thanks for sharing your experience. So I think we have to cover both the fundamentals as well as the clinical experience, which is I think different from other health profession, because some other health profession, they're focusing more on the application, not necessarily the basic foundation. And also basic foundation is important and relate to what you were saying, to develop these critical thinking skills, right? Through through the education that sort of develop your physics understanding. I think we've covered quite a lot already. So in terms of the education, the professional organization, and also how education impact the profession. So I think we're gonna look at our audience response from the question. So the correct answer is all of the above, which is below now because the answer goes up. So AI, the primary goal is also to replicate human intelligence, even though you may not be able to actually become the same as human intelligence. Also can be used to solve complex problems. Would you want to comment? Do you want? Okay. Okay. So yeah, with interest of time, we're gonna move to the second half of our session. So now we are gonna look at the wider aspect of the professions. We're looking at private sectors, the government sectors, both KKM, also input from mostly agencies as well as class H companies industry. So I'm going to start with Dr. Heng. Maybe we can move back to Dr. Heng from Sunway Hospital. So we know that it's one of the leading cancer hospital in Malaysia at the moment. Very good facilities and have state-of-the-art equipment. So but in the context that we discussed, in the context of medical physics support for cancer care, sorry, I actually jumped a bit. Oh, okay. Actually, the first question to you is on how private hospitals might play a pivotal role in supporting professional growth, especially through training with state-of-the-art equipment and facilities.
Can you hear? Oh, it's too loud. I think I received the comment from my ex-staff just now. The camera cannot really see me. Can because I say I'm the unsung hero. Okay, good to see everyone here. this is the topic that I think I would like to share for me as a working as a medical physician in private sector. Actually, I started my work as a medical physician in May 2005. It's almost 18 years. So can you go to the next slide? I think Miss Kala will be agree with me because when we are working in the private hospital, we are driven by the competitive pressure. For a private hospital, we always wanted to invest in the latest equipment. Yeah, this is our pressure, okay, in a private hospital. But I think it will also a very good platform for the physicians who are working in private because they had the opportunity to work with so many advanced technologies. So I would just take Sunway Medical Center as an example. I joined in 2016. You can see that we had invested so many equipment for the medical physicists to play. I always say it's a toy for them. Yeah, so I saw it. I think it's a very good site for the physicists to learn all the different technologies, and also it will enhance their cutting edge skills and also competencies. Apart from the advantages of had the opportunity to learn all the advanced technologies, it also gives an opportunity for the physicists in private hospital to be involved in research. Yeah, but it's not only for the research. I think for my team, they are too occupied with the works. They don't really have time for the research at the moment. So this is our aim. With so many technologies, our aim is to be involved in research and can improve the patient care. I think this will be our final aim. That's the reason that we invested so many equipment in our hospital. Yeah. So maybe I can go to the next slide. Okay, just now Miss Kala mentioned about critical thinking. So to be honest, in private hospital, we don't really have a structured program for the medical physicists, which my team actually are working on. We are hoping to produce a training program for all the medical physicists in at least in Sunway Medical Center. But in Sunway, we do have the resources to organize a training to enhance the staff critical thinking. So we can see the slide here. Go back to previous slide. Yeah, we do have the free training program to enhance also the communication. I think as a medical physician, it's not only for the critical thinking, we also need to have a good communication because we need to communicate with your team. And most importantly, I think we have to communicate with the oncologist. I think time had changed. What I can see that since day one, I work as a medical physician, the consultant always asks a medical physicist's opinion. So we are actually colleagues. They didn't treat us as a staff, they treat us as a colleague. So we always had I think we need to read a lot because the oncologist will ask your opinion because you are expert in your field. You are good in treatment planning. You are good in how to minimize the side effects. So I think I think I'm very great enough that we can work in this kind of environment that they treat the medical physician as their colleague and not as a technical staff. Yeah. So I think working in well-established hospital, we also had the opportunity to work with many other healthcare professions. For example, radiologist, surgeon. Every week we do have the opportunity to attend the tumor board, where sometimes the consultant will ask our opinion. For example, for lung cancer, this patient can be treated with surgery or can be treated with SBRT. This is the thing that we can exchange idea in order to improve the patient outcome. Yeah. So the next slide I wanted to highlight will be, I think in private hospital, it's a bit different compared to government hospital. We do have two different career pathway for the physicists. So you can see that for the first, once the physicist join a private healthcare, normally you will started as a junior medical physicist for 2 years. So after 2 years, we will promote the physicist to become medical physicists. But after medical physicist, normally we will ask the staff which will you prefer to go, left or right? You want to go to the operation or you want to go to the clinical side? So this is a very clear career pathway for the physicists to choose. Because sometimes after a few years, I say, okay, I'm not interested to be involved in clinical anymore. I want to become the administrator like Miss Keller and myself. So you do have the two different pathway for for you to choose. Yeah. So I just want to highlight it's a bit different compared to government hospital. Yeah.
I'd like to add that point of note, right? So actually, if all of you all think that being a physicist, you only can be in a technical or clinical line, no, you can actually grow further. But the important thing is, as you mentioned, you need that many years of that experience. So when you sit there, because you will have to give the right advice, it can be involved in all your big projects in terms of procurement of a lot of things, how you're going to shape the expansion of your cancer unit. I believe, Dr. Heng, for you also same, right? An expansion of a cancer unit in a private setting, you will be the main driver of the project. Okay, you will be the main driver of the project. So you also have to equip yourself to that level. So as she mentioned, when you are at that level, they will treat you as colleague. Your opinion matters. Your opinion matters. But as you mentioned, like 16 over years, 18 over years, more than 23 over years, it takes time. It is not a shortcut. That is something for this profession I need to, I hope you all understand, sometimes the generation gap they think is something that I can very fast. No, I think it's something you actually build. But whether you have a future, definitely you have. And nowadays, not only in oncology, I think nearly every equipment, be it in the OT lah, also is some way or not, you will be involved in certain all this equipment purchase and all that. So growth for medical physicists is actually two ways. Either you want to go clinical or you definitely want to go admin, but your clinical knowledge is what is going to make you a good administrator. That you should not forget. Okay, thanks.
Thank you both, Dr. Heng and Ms. Kala. Very interesting perspective from the private sectors, because you're more flexible compared to like the other government sectors. So next I'm going to go to Puan Mahazom. So she's a very experienced medical physicist, also from one of the leading cancer hospital in Malaysia, Institute of Cancer Negara. But I think Puan Mahazom also has started somewhere, and also KKM has started somewhere from, I think started from HKL before. Yes. When they started with the first LINAC, and now we have IKN with a big facility with a lot of LINAC. So maybe you can share with us how the development of medical physics in the government sectors and also the profession as well.
Thank you, Dr. Hafiz. Okay. Okay, I would like to share my experience. Actually, I'm working in KKM since year 1995. When I first joined at that time, actually, we only have 6 medical physicists working in radiotherapy. And in nuclear medicine, also we have we have 2 medical physicists. If you want to ask regarding evolving, actually, we started medical physics profession in Hospital Kuala Lumpur in year around 1960s. That's the first. But at that time, we don't have local medical physicists. The first setup was carried out by medical physicists from overseas. At that time is Europe, from UK. And even the RTTs also from Europe. So they are the first considered pioneer to start the services. And then from time to time, I think at that government start recruit local medical physicists, and were trained in overseas. Most of them were trained in overseas related to the machine that they bought at that time. So currently, actually, we have altogether around 200, almost 260 medical physicists working in clinical and regulation and enforcement. So actually, only 25% of the total working in radiotherapy specialized in radiotherapy, and the rest around 33% working in radiology, and then we have about 14% working in nuclear medicine. The rest is more on enforcement and regulation. So in terms of number of medical physicists, we can see there's an increase, keep increasing, but for the past 10 years, the numbers not changing much. I mean, there's like we have a plateau value lah, not many, we don't have a significant increase in terms of number of posts created for medical physicists in government sector. But it different in private sector. So in private sector, you see that the number of hospital keep on increasing, and the intake for the medical physicists also you can see there's keep on increasing like in terms of numbers. And then okay, that one we talk about the evolving of medical physics in government sector. So actually what the medical physicists did to cater or to service MOH in terms of cancer care, for cancer care. Actually, as I know most of the us here, I mean the audience, if you have the background of medical physicists, you know that in clinical we have three specialized medical physicists, which is in radiotherapy, nuclear medicine, and radiology. And whether we work directly or indirectly to cater cancer services, it depends on what type of services carried out by the department. I think in radiotherapy is of course 100% we cater for cancer patient. Whenever patient was confirmed diagnosed with cancer, that patient will be referred to our radiotherapy oncology department so that they will have get their treatment according to whatever type of cancer they have at. And but for the nuclear medicine lately, we can see there's a progress where they also offered treatment for the cancer patient. Like nowadays, there's a new technique of treatment. They call it theranostic, targeted therapy, where they use radionuclide to treat cancer patient. And the demand is, I mean, the number of patients treated also keep on increasing. So we need more medical physicists that involved in dosimetry to help expand the services or extend number of patients that can be treated using that technique of treatment. And for the radiology also medical physicists, I mean, indirectly they involved in the cancer treatment because they are doing the screening for early to detect early cancer cases. So as a general, medical physicists play a vital role in terms of QC of machine equipment. So we are answered to under the Act of 308 304, sorry 304. Okay, under this act, actually medical physicists, we have a responsibility to make sure that all radiation equipment or radioactive source was managed properly and machine is working according to spec that is safe to be used for clinical. So we work as a background in silo, where when everybody is taking lunch, at that time we do the QC for equipment for machine. I know, yeah. So, but nowadays we also involved in the planning of patient treatment. I mean, whether you work in radiotherapy and nuclear medicine, that is part of our job duty. So, in terms of a machine, we also involve, yeah, for the procurement of equipment. So if we need to um to have a knowledge, basic knowledge of physics and knowledge of on equipment to so that we can consult or give our opinion to the team, which type of machine that is good to to I mean whether the machine is suitable to be used for the purpose of the treatment. So because sometimes there's a I mean technology evolve. So there's more many apa new technology, new machine coming up kan in the market. So we must know what is the which one that is suitable for our center. Not all center have the same objective. Like private, they are more advanced because they cater number of patient, or they want to promote their center, so they need to give a better machine for their patient. But for KKM, our MH, we cater number of patient, a lot of patient every day. So we need a machine that can work. Can cater more patient. That is more robust. Because we don't have time to think of the too advanced, but just a certain number of patients that can be treated. So it's different because we are not give services for money. We collect just a minimum number of fees from the patient. Yeah, like saying, so there's a gap between what KKM did and what the private did for the country. That's my opinion. If you have any other question, then you can ask.
Thank you, Mazum, for sharing your insight and also experience for, I think, over 30 years, 40 years.
I have been working for almost 30 years
30 years.
in
Okay.
KKM.
Thank you for sharing your insight. So certainly that shows the importance of how we can actually bridge the gap between private and public sectors, how we can work together to address the importance of the clinical training set to achieve all those issues. So I think I also have the opportunity to also share this paper from our speaker this morning, from Dr. Azrul, where there's the gap in our cancer care in Malaysia, where we probably certainly can work together. Also, it shows that there are still many opportunities that lies with the further development of facilities in Malaysia, and also the needs for medical physicists in Malaysia. Because we are running out of time, so I'm going to move the next. So this, maybe we need to have another forum to discuss about this public-private sector partnership, maybe in the next SMP. Yeah, do you want to add on?
Private, can I just add? Actually, private PPP is actually ongoing even for oncology. Because whichever room there is available, if the private sector and in that certain group, we do take in government. I mean, in my Beacon Hospital at one particular year we did. So PPP in terms of government and private hospital, I think wherever possible, I think the private sector will definitely try to assess and assist lah. Because this one we ourselves at Beacon Hospital actually had a PPP with HKL. So it also depends on our capacity. If we are able to, I believe definitely because there is already this program of PPP and we have exercised it before.
Excellent to hear that. So we move to Dr. Husaini, is the Director of Radiation Safety and Health Division of Malaysia Nuclear Agency. So for Dr. Husaini, so perhaps we can hear from Malaysia Nuclear Agency what are their roles in the development and research in medical physics, basically.
Okay, thank you, Dr. Hafiz. So actually in Nuclear Malaysia, we have a medical physics group that is under the metrology group. Okay. Then in 1995, okay, the establishment of the medical physics group. Actually, it's split from SSDL. Okay. So I think 29 years running on of the medical physics group. What we do in medical physics group, actually, we have the calibration lab, okay, calibration bunker, dealing with the meter, the dosimeter from hospital, okay. Actually, we have license from two regulatory, okay. One from the Ministry of Health and the other one from JTA. Last time they call it LPTA, AELB, now JTA, Jabatan Tenaga Atom. Okay, so having these two license, we are exposed to be audited by two regulatory. So you just imagine, okay. And then the officer there, actually in Nuclear Malaysia, our scheme is research officer, pegawai pendidik. Okay. So we have around 13 officer there. Okay. Now, under the license age, we already have 6 medical physics consultant. Okay, this is under license age issued by Ministry of Health. Okay, so I'm one of them, the medical physics consultant. So our scope is more on diagnostic radiology. Okay, so actually we have this section, diagnostic radiology, nuclear medicine, and also radiotherapy. But starting from the 1995 until now, we still focus more on diagnostic radiology because of shortage of manpower. Okay, Dr. Gini did the, what I call it, the sabbatical leave at Nuclear Malaysia under medical physics. Okay, attachment. Okay, so me myself actually under license age, I am medical physics consultant. Under license issued by the JTA, I am radiation protection officer for Nuclear Malaysia Agency. So this is the scenario in government sector. So for the R&D, research and development, so our research more on supporting the service we provide. Okay, so we provide the QC test at for the hospital and clinic throughout the country, and then the lead equivalent thickness test for the exposure room. Okay, and the other job is related to the calibration of the test tool. Okay, this is the scope under the license. Okay, so we cannot do outside the license scope. Okay, only so that's why in Nuclear Malaysia we don't do the radiotherapy QC test. Actually, we only have cobalt 60. It is just for the calibration purpose. Okay. and we do more on development. Actually, I found the proposal paper in 1988, done by my superior, Tuan Haji Aziz Ramli and Mr. Haji Izhar. So in 1988, this paper proposed to Ministry of Health the proposal for doing the QC test at hospital. So you just imagine the enforcement for the QC test by Minister of Health, I think started in year 2000. So means 12 years after the proposal. Okay. Basically, we have the problem to expand our scope because, yeah, you already know, because we are the government sector, and now with the policy of 80% of the what they call it, the pengisian jawatan, only 80%. So if you have 1,000, so last time our staff is around 1,000. So nowadays 800, around 800. Okay. So me myself actually I am a pioneer batch of the medical physics group. So only me now available. The rest were retired already. Okay. Okay. So just imagine. That's why I think for the expansion, for the investment, is good to go to the private. Because for government, maybe we can do focus on research based on the RMK. Nowadays, we have under the metrology group, we got the RMK 12, 18 million for 5 years. So this is for our purpose to go for the primary lab. Because nowadays we as secondary SSDL. Now we are moving towards the primary, but 18 million is nothing for primary, because Thailand did the investment 40 million USD. Okay, so that's all from Agency Nuclear.
Yeah, thanks, Dr. Sain, Dr. Sani, for sharing. What you're doing. I think it's related to Act 304. Right? Earlier we heard about Act 774. Now I forgot already. so
Originated from Act 304 because you need license.
yes, true. So both to ensure the safety and quality of the fields in related to medical physics, basically. So speaking of private sector, so next I'm going to move to Dr. Rosanna. But before that, we have this Slido questions in terms of your views on this external quality management and all this came because we'll be discussing about quality and safety later with Dr. Rosanna, sorry. So, so we appreciate your response. So we show the response after Dr. Rosanna's response. So Dr. Rosanna is with what company is it? Quantum Medical Services, right? So sorry, Quantum Excellence, sorry, Quantum Excellence. So I think you understand well the aspects of safety and quality because I think you also have Class H services. So maybe you can comment on the importance of this as well as relate how AI would actually come and affect our roles as a medical physicist. Okay.
All right. Thank you, Dr. Hafiz.
Um, Good afternoon to all of you. I'm actually very pleased to see a lot of young faces interested in this field. Alhamdulillah. All right. To start out, since there's mention about Class H, maybe I can just quickly share with you what this Class H means. It's a license that's given out by the Ministry of Health to an organization that have a team of qualified people who can actually go out there and check radiological equipment and certify that they are working in safe and optimum condition. And also at the same time, with Class H, also there is also a bit of a room to allow us to do some training aspects relevant to the field, in radiation protection, in testing of equipment, and why it's important to conduct this for the safety of both workers as well as the patient involved. All right. And I think there's also, since Dr. Jeannie mentioned about training, so in Class H, we have these so-called consultants, the medical physics consultants, which should be the medical physics expert, or as Dr. Oliver they said that, or he used that term, but in IAA, they're also using the term clinically qualified medical physicists. So as Dr. Jeannie mentioned, then perhaps in the training or when the authority decides to say this is a consultant, the qualification, the experience they have, then perhaps in the training, you can incorporate this adequate training. I have to stress that as you come out from a medical physics program, you should be one that has been trained in terms of education and clinical training to be competent in your work. And beyond that, also have some exposure in the medical environment so that you can then apply what you have learned, both in terms of the theoretical and your practical experience in that. All right, so so that's it about Class H. For me, basically, I started in government service, but I left government service into retirement, but decided that I want to come back to the field. So I have this little company called Quantum Excellence, and we have been privileged to have a Class H license and to carry out these duties. But otherwise, I just want to talk about some of the responsibilities and which way we are heading as medical physicists. Also, Dr. Oliver Diaz mentioned earlier that that we must be prepared for AI. We must be prepared for AI. As undoubtedly, besides the healthcare punya processes, undoubtedly AI is going to change also the medical physics profession. Yeah, and the roles of medical physicists. And he did mention that AI will not replace medical physics, but medical physicists who use AI or who are trained in AI may replace those or do better than those who do not use AI. Yeah, so we must be prepared for this. And in terms of some of the roles that may change with AI, as we see from other speakers as well, that AI will perhaps relieve some of the work of medical physicists. For example, say in the context of us checking and certifying the fitness of radiation equipment, some of this repetitive process, like analysis, reporting, we can use some AI tools to do that for us. Yeah. So at the end, that will shorten the work process. But having said that, it is still our responsibility as a physicist to ensure, to vet through and ensure that the reports come out reasonable. Yeah. And then at the end of the day, we want to
the end game is that we want to make sure that the equipment is functioning at an optimum condition and that we get good quality images. I'm talking in terms of the diagnostic radiology, and at the same time, at the lowest possible dose to the patient. Yeah, so that is one of the aspects where we see where AI can help in our work. And then perhaps another example that I can give for some of you, I'm sure you've heard of those days, the conventional radiography, but I think now majority of the equipment in terms of doing radiography is digital. Yeah. So in digital, we have already knowing or not, we have already embraced AI into this, because if you realize that for those who work in as physicists, these equipment, this digital radiography equipment, can almost always give you a good quality image, regardless of whether there has been an error or not. Yeah. So if you underexpose, you overexpose, it will come back and give you a good image. Yeah. So we see now our role as a medical physicist is not so much checking the image in terms of the optimum operating condition, because the equipment is smart enough to do it on its own. But now the role of us is actually now to ensure that the doses delivered will be minimum whilst getting that good quality image. Yeah. So so very easily there's, we are already in it, and we have sort of to prepare for ourselves for things that are yet to come. Yeah. And also there's a few things because of the short time that I thought I better write some notes here. And the other thing that I would like to mention also very quickly is that there's a few other things that it is also important that we are prepared for AI. As Dr. Oliver mentioned, that we can take some classes, we can join some projects, yeah, so that we sort of ease into this. Yeah, and you'll see that there is a lot of potential us as medical physicists to embrace this AI so that we can apply it. Yeah, there's a lot of things. And I just to name a few that perhaps we're talking about QA. With AI, we can actually develop machine-specific QA, yeah, rather than just a general set of parameters that we need to check. Perhaps, they are machine-specific. And another is that we can use AI to monitor the performance. So we do the test this year, we do the test next year, following year. So we are looking at the performance of this equipment and using AI to predict potential faults that are to come. Yeah, so that we can schedule the maintenance, we can schedule a QA retest appropriately, knowing that that there is that potential for this equipment to fail, or it is already going a little bit under its optimum performance. Yeah, so I think because of the time, I'm actually tapping my phone every time just to make sure I'm within the 6-minute limit. Sorry. So, but then I'm so sorry. And then I think everybody wants to also take their leave. But as a conclusion, whether we're talking about the medical physics experts or the clinically qualified medical physicists, I think if you embrace this future of AI and be prepared for it, I think we as medical physicists can be the bridge between this so-called complicated tool to the needs of the end user, which is the clinicians. Oh, all right, thank you. If there's any questions, I'll be happy to take some.
We'll take at the end of the
Okay,
session.
right.
We still have a bit. Actually, we exceeded the time. Not you, but the whole of us. But yeah, thanks, Dr. Rosanna, for your insightful comment. So we have to be a step ahead of AI, and I couldn't agree more with your points on. Now we no longer do QA like based on what's the maximum tolerance level. So we want to personalize it in terms of what the machine can give us. So we want to minimize the uncertainty as low as possible, so that we can actually deliver the best outcome to the patient. So I think we have actually gone around all the panels. Maybe we can actually go back to Slido to see the response in terms of audits. It's just that unfortunately we don't have time to discuss further on this. Maybe this would need another forum. But it's happy to see that a lot of people have participated in some form of audit, which is good. And also, I think a lot of people are aware of the importance of audit, external audit. And let me see, can we go back to the slide, please? Thank you. So yeah, that's the end of part 2. So can we take questions from the audience, Dr. Nora? Asking this person. Okay, so I'm gonna open up Slido Q&A open text poll, so you can actually enter your questions there if you have any. I don't see any questions on our live stream on Facebook. But there's some comments. We will actually, I'll take that in the summary later. But if you have any questions, you can actually post on Slido. Can we please put our Slido back, please? Oh, everyone is already tired. Nobody said so. So maybe they're just waiting for questions to come up. Okay, if there's no questions, okay. Oh yeah, you can ask directly. Oh really? Oh there. Oh, it's not coming up. Let me check on my. How can I cancel? Artificial intelligence is medical physics complicated. What is the relationship between AI and machine learning in medical physics? Okay. So maybe somebody can actually.
Right. Hello. So I'm going to try to answer that one. But if you remember the slide, the lecture before, I think by Dr. Oliver also had this talking about this AI and machine learning. The AI is a broad term that encompasses everything that you think AI is. Okay. But machine learning is only part or a part of that. For example, you can have different techniques that use in AI. So machine learning are typically like the SVM, the K nearest neighbor, different techniques of actually they are more like statistical methods in analyzing a big set of data and then doing a big model to predict the output. But AI is bigger. So under this, there is also things like deep learning, which you may have heard about it, and which is what the Dr. Lu from the Germany who talks about. He developed. I think he developed this. Is it this adaptive prediction AI using the model base, and they use many deep learning models and all that. So there are different machine learning are different small subsets of the bigger AI. So AI is just a broad term of machine computer that can analyze big sets of data and then produce a model that can predict the outcomes. Yeah, so in medical physics, then it is basically the application in medical. So probably Dr. Rosanna maybe just now mentioned an example of this QC, for example. The QC is where previously you just do, you collect your data, your QCs of your annual QCs, you have your LINAC performance every year. But if you can collect all these sets of data together and then you do machine learning on it or deep learning, train it through some deep learning model, perhaps you can work towards predicting when the machine will break down, when you need to replace your LINAC, And then you have something that you can go to your management and say that, look, I've got something that tells me that in 5 years' time, we need to replace our machine. So so that's some examples, but also the examples that's mentioned just now is like auto segmentation and all that. How to do auto segmentation can be based on machine learning, can be based on deep learning. So as a medical physicist, we need to ask the question to the people who provide us with the software to say, oh, my software can do this. Then we need to be asking the question and say that, how do you do it? If you said deep learning, what type of data have you trained it on? How big is your data? What model are you using? What's your sensitivity? What's your accuracy? You need to ask this type of question and be able to understand what are the things that they're saying, to be able to gauge whether, okay, if this is, mature technology. So that's what Dr. Lu also said, that there's a lot of people who develop algorithms, but they're not mature yet. So a lot of publication has algorithms that are very at a beginning level. Those that are able to bring to commercial has to go through a very, very rigorous process before they are mature and safe to use. Yeah?
Actually be commercially available. They can actually develop, but you must get all your FDA, and in Malaysia you have to get MBA clearance. Even now you have a lot of AI software companies from overseas actually approach us for like free trial. They'll say, can you try this for auto contouring and all that? But all these are on trial basis lah. They also will give you a disclaimer. So there are also a lot of them out there, I think, trying to come up with new things, and they want to see which one suits best or optimizes a workflow the best. But eventually, as you mentioned, you have to ask all these questions. So I think before you use, they also need to get all this clearance before you actually use it on a real life case. I mean, otherwise you are using it, but the liability falls 100% on ourselves before we do it. Yeah.
Right. Thanks.
Thank you both for the response. So I think we can end the Q&A session. I think this is also related to examples that Dr. Jenny gave, and maybe we can already conclude because we already way behind schedule. So maybe we can go back to the slides if possible. Right. Okay. It's multitasking. so this is the end of the session. So I would like to, before I thank all the panelists, I probably make some summary. So just 3 short points. First is the importance of medical physics education and clinical training. And we can see there are avenues for collaboration between different agencies to support our profession development, especially in terms of education and training. And I think we can see a bright future ahead if we all work together towards achieving this common goal. So with that, I also would like to promote MUM membership. So we still retain the same fees since we started 30 ringgit for annual membership, 300 ringgit for lifetime membership. And we have this promotion now. If you join as life member, you get a free pin badge, which is very nice. So please visit our booth downstairs at the very left among all the booths. We also have merchandise that you can buy saying that you are a medical physicist. So with that, I would like to thank you all the panelists. It has been a pleasure having this very interesting chat with you all. And I think I'm sure the audience also find it very interesting, I hope. So with that, thank you all and have a nice evening. Thank you.
Thank you so much, Associate Prof. Dr. Hafiz, and also all the panelists. So before we wrap up our session, so I would like to invite Professor Wan Ahmad Kamil. Yes, please. to come to the stage and give a token of appreciation to our moderator, Associate Prof. Dr. Muhammad Hafiz. Okay, first to Dr. Heng Siu Ping. Okay. Okay. Next to Dr. Muhammad Hafiz. I would like to invite Puan Mahzum. Thank you. Dr. Rosanna Hussein. Thank you. Mrs. Kala. Thank you. TS Dr. Husaini. Thank you. To Associate Prof. Dr. Ginny. Thank you. And last but not least, to our MUM President, Associate Prof. Dr. Nara Maliza. Thank you, Prof. Wan Ahmad Kamil. So as a wrap up, I send gratitude to all the panelists and also participants. Okay. So let's carry today's momentum into tomorrow's session. Okay. Safe travels to all. Thank you very much.